joining us now. She made a great speech in D.C. last night, opening day of the convention. Amy Ford. Amy, great to have you with us.
Thank you for having me.
Look, I thought you were fantastic last night, sharing your experience as a registered nurse working in 2 states. Just for those that missed last night, just give us a little overview again, Amy, of what actually you did in the 2 states in fighting coronavirus and caring for people that were in the hospital over it.
Well, I went to New York. It was like the end of March, but we started work on April the 1st. I was there for 8 weeks. I work in ICU. I'm an ICU nurse. I did the same. I took a month off, or about 4 weeks, and then went to Texas and was there for 6 weeks, again in ICU. So it was I worked with kind of the worst of the worst patients. In New York, it was extremely overwhelming at times, just because, it was new to everybody. It was new to us. We didn't know a treatment plan. We didn't have one worked out. It was kind of winging it, living on a hope and a prayer that, the treatment we were given was going to be successful. But that's pretty much what I did.
You said last night you were kind of refuting the media's fake news and explaining from your firsthand experience how President Trump's leadership in expanding telehealth services during the pandemic saved and are going to continue to save lives. Amy, can you elaborate on that?
Yeah, kind of. My thing is, you can have different political views, you can have different opinions or ideas, but at the end of the day, you can't change facts, and those are facts. Everything that I stated are, it's fact. He did, have deregulation of telehealth in order for it to be implemented and used and more accessible to so many more Americans. Because prior to COVID, the restrictions on it were insane, and you couldn't hardly get it, get to use it because of the restrictions. And when you could, it was, did you get reimbursement for it? So, like I said, facts are facts. At the end of the day, you can have a different political stance, but he did implement those changes in order for us to use it, and it was extraordinary for COVID.
One of the things that you said last night, let me be clear so that the media cannot twist my personal story to fit their narrative, which I thought was a great line. You said, as a healthcare professional, I can tell you without hesitation, Donald Trump's quick action and leadership saved thousands of lives during COVID-19. Tell me what, had he not done that, Amy, based on your experience, tell me what would have been different.
Oh, of course, you have to think of, when I said our populations, the most vulnerable populations, you're looking at our elderly and our children who, would be required to go. On a normal day in a pediatric office, it's crazy. You're sitting, prior to COVID, you're sitting with your hands to yourself, making sure you don't touch anything, your kids don't touch anything. The risk of exposure is phenomenal. So with COVID, that blows it out of the water. And so by implementing that, it decreased the exposure of our elderly and our children by having to not just go to the doctor's office, but, what if you have to stop and get gas? Just any exposure that you were having to get, it diminished that greatly by being able to say, okay, I can just visit my doctor from the house here. He can tell me what he thinks. Now, if I need to go into the ER, then fine. But, I don't have to just go in to say, hey, I'm having these complications, and then they send me right back home. So it was great. It was absolutely necessary and needed, especially during the pandemic. It was needed prior to, but, the implementation of it during the pandemic was it was just life-changing, truly, for healthcare.
I just have to really commend you, Amy Ford. We're with Amy Ford. She's an RN, 17-year RN. She fought COVID both in New York and Texas, 2 of the hottest spots in America. When you were deployed to these places, putting yourself in harm's way, what did your family make of this, Amy?
Actually, I'm very blessed. I have the best support system ever. My parents, they were like, well, we don't want you to go, but we understand why you're going, and just be safe. I mean, they absolutely, rooted me on and supported every decision that I made, even when I decided to go back to Texas. They were just amazing, truly amazing. I couldn't make it without my mom and dad.
in all, well, and we thank them for that. In all of
Yeah.
in all of the exposure that you've had to people with COVID-19, did you ever test positive?
I did not.
How did you protect yourself?
We were provided PPE. I mean, every shift. There was never a question. I never worked without it. Period. Like, no exception to it. And I attribute that to me not getting it.
There's a lot of talk that hospitals couldn't get enough PPE, that the government didn't do enough. Were you ever wanting for it? Were you waiting for a shipment to come in and you put yourself at risk at all?
That was never an issue for me. And again, I understand that there are people that said they suffered that, and it's unfortunate. I personally did not in New York or in Texas. Never ran across that at all, not even close to it.
So, Amy Ford, walk us through how you got from New York and Texas fighting COVID-19 as an RN to a featured speaker on national TV at the Republican National Convention. Walk us through how that happened, Amy.
Well, when I was in New York, I had it was one of those times when people were, saying that it was a hoax, it wasn't real. The trucks outside the hospitals were not filled with bodies; they were fake. So my parents they encouraged me to make a Facebook post just to inform our little community, hey, this is real. I'm here, I'm seeing it, it's real. So in attempting to make a Facebook post or status, it was just too lengthy. I decided to do a video. Well, I made a video and it went viral. And somehow at some point it ended up on the desk at the White House. So they invited me, while I was actually still in New York, they invited me there for a ceremony of recognition for my service. So I attended that. And then when I was coming home from Texas, the day I was flying home from Texas, they contacted me again and asked if I would, want to participate, which I didn't know that it was going to be to this magnitude. I didn't know I was going to be giving a speech and everything.
You did great last night.
Thank you.
You did great last night. I thought you were fantastic. You were very warm, and you did, for a person that is not a public speaker or a politician, you're just helping people, helping the sick. I thought you did a remarkable job last night, and you and your family should be very proud of that. What was the video you did that went viral?
I did a video just saying that it's real, encouraging people to stay home, and because at that time was when they had everything on lockdown.
Right.
But where I lived, there was were not a lot of cases, so people weren't seeing the true effects of it, and so they were just going on with their day to day. It was still letting the kids have play dates, still going over to Mama and Papa's house with aunts and uncles and everybody, and they were like, "Well, I'm just around my family." No, that's not your family. That's 15 people outside of your family. So that's the video. I just made it saying, look, this is serious. Please, right now, we don't have any solutions. We don't have any medicine. We don't, pretty much what we do have control is us. Us staying away from each other, and social distancing at this moment and point in time will allow us to get ahead of this virus as opposed to chasing it. So.
All right, I got one more question here from one of our listeners. This is Den in Chesapeake, Virginia. He says, would you please ask Amy Ford about the fact that those up in age are the ones who make up a huge percentage of the COVID-19 deaths, and why they are the ones who really need the protection?
The elderly are always at risk or a higher risk with everything. I won't say that necessarily with COVID. I know that they've attributed to more of the deaths, but not from my experience, not with the personal ones that I took care of. We had a wide range of ages. But I mean, like I said, the elderly are always at a higher risk for anything. So especially COVID. I mean, they have all these comorbidities. I mean, again, I wouldn't. Before I left for New York, I took my children to my mom and dad's and decided to leave them there because me working every day and risking exposure, I didn't want to risk exposing my parents. And they babysit while I work. So, you know, they're in their mid-60s. I didn't want to risk it. I mean, that's just something that, you know, you kind of have to take into play and try to protect them, you know, in any way that you can.
Well, Amy, great job last night, and thank you for all you do. I'm really honored to have you on today, and keep up the super work, Amy, and thank you.
Thank you so much.